Yes, you're gonna have people turn their backs, but it's time for us to keep it real. Just keep talking that real, bro. Do what you do. I know what you do, so keep doing that. Talk the real.
The HBI lads will see you now. See you now. See you now.
I don't want to cause no problems. I just want to live my life, but I keep on hearing about nonsense.
And we're back. Not quite as good. Not quite as good as Nathan. So with your new host today, Daniel Kirkbride, we're missing the boys, Mina and Nath today, unfortunately, due to father duties. But it's just me and Ben today. So the two that Opera love to hate.
Yeah, the opera bandits right here.
The bad boys. I'm going to talk about exercise prescription today. So only the two of us. We're going to talk about something which I see a lot of, and I'm sure Ben does as well, which is a struggle to try and blend exercise prescription when it comes to early stage rehabilitation and then taking someone from that early stage through to like end stage performance. So, a very compartmentalized approach, which tends to happen a lot, is, we give people their corrective exercises and their like early stage stuff. And then there's a bit of a gray area in the middle, where the water's under the bridge. And then somehow we've got to get back to people lifting again. So we're going to talk about, what I'm going to talk about my principles. Ben's going to talk about his, and then we'll see if there's any crossover, and which I'm sure there will be, and go from there.
Sounds good, bro. I think this podcast will be pretty good for it's because at the moment, like, we're all a bit of a hybrid of a practitioner. So we got, Daniel as an osteo, obviously got Nath, Cairo, Mina, Maya, myself, a physio. So we all tend to, dabble in pretty heavily in the strength and conditioning, rehabilitation, programming. And as Dan said, we want to try and make it a bit clear as to, at what stage should you, integrate what kind of rehab and justifications for doing so. I think that this episode will be pretty helpful for some students, obviously allied health professionals across the board, and even for, I guess, clients who are listening in who are wondering, what kind of health professional or what kind of people should I go to work out, who's going to give me the appropriate strength and conditioning programming. And I guess when is maybe a time also to change practitioners and that sort of thing if you're not getting the results that you're after. So I think, Dan, as you mentioned before, this one's also pretty directed at the health professionals and making sure you're making the right decisions for the person. And often it can be quite tricky to, take the person from A to Z. A lot of people and a lot of physios tend to be quite good at, early stage rehabilitation, that sort of thing. But I kind of see a lot of exercise physiologists and scientists sort of really, and even personal trainers and strength and conditioning coaches, taking people more on the performance sort of integration back into sport and performance end of things. So I think that getting some principles and almost rules around sort of how you progress on will be pretty good. So I'm happy for you to lead it in.
Yeah, I think another thing too is more so like from a practitioner point of view, knowing like when to actually pass on, because you don't necessarily have to do it all. And I think there's a bit of, with the whole movement of hybrid practitioner and, exercise prescription and all the, obviously the research on movement, there is a little bit of extra pressure on practitioners now to go in and go deeper into exercise prescription, which I think is good pressure, because it means like, obviously it's making everyone upskill and level up and have more awareness. But at the same time, I think it is also not a con, but it can be a bit too much pressure where like a lot of people, this is my experience, I don't know what yours is, but like by, mentoring a lot of like therapists now, a lot of them getting a little bit overwhelmed almost, like, I've got to be able to take someone from A to Z. It's like, you don't necessarily have to take someone from A to Z. You can still be a great osteo, physio, chiro, myo, insert practitioner. It's more so just like understanding how much what your limitations are, and then, how much you actually want to deal with. Because if you don't have any interest in performance, or more importantly, you have no experience in performance, then it's going to make it very, very hard for you to go there. And it's like, if you know that I'm happy with just doing the manual therapy, having an understanding of the prescription and being able to give the early stage stuff, but like I have no interest in weightlifting, strength training, powerlifting, running, training, any of that. So like, this is where I kind of, step out, and this is where I then refer to a different practitioner, refer to a strength coach, et cetera, et cetera. And like, that's completely fine. You don't have to be able to go to point Z. You just have to know like what you want to do, and then do you have the requisite skills and knowledge to actually go there?
Yeah, that's good. I think identifying your limitations, and a big part of what you mentioned is actually what you're interested in doing and what you want to do as a practitioner. Like, and that's, I guess, a great thing about a business like Mina's, for example. You've got Mina, my therapist, got a couple of remedials, got osteo, and obviously they all dabble with a bit of rehab, strength and conditioning. So having like a team around you is a perfect way to address some of those things where you don't have to be the one man show. But as Dan said, it largely comes down to a personal thing for the practitioner, whether, are you interested in taking someone from, a shoulder reco through to returning to swimming or something like that. For me, I understand the principles and how to get someone from A to Z, but this person would probably be better off seeing someone like a physiotherapist, for example, who may be a swimming, specialist or a special interest in swimming. It's just making sure the person is seeing the right, the client is seeing the right practitioner, and that also the practitioner acknowledging really personally to themselves, like, well, should I take on this person? Should I, fumble my way through this person's rehabilitation? Just hopefully they get there in the end. It's I guess a bit of an ethical thing as well. It depends if you're in it to make money, or if you're in it, for the passion of the job, or, there's so many variables we kind of play, but I think we get into it because I'm getting too political now.
No, I think it's the old saying. It's like, you can't teach what you don't know, and you can't give what you don't have. So if you sometimes, it's just knowing when to give it off. I think some of it comes down to ego as well. Like, I had a situation probably a few months ago where I probably should have palmed off, and I was like, nah, I got it. Like we've all made those mistakes. So I think it's more so just understanding limitations. But the reason I brought that up was more so, it's like when you look at traditional osteo, chiro, physio, or even like osteo in particular, like physio has always been a bit more in sport, and chiro a little bit as well. But osteo traditionally, it's like a lot more holistic in its approach. It's like you got practitioners I know who are like absolute weapon osteos who have no interest in rehab or no like real knowledge in rehab. It's like, doesn't mean they're now a shit practitioner. It just means like they fit on a certain part of the continuum, and then like knowing where they fit and how they integrate with other people can still make the process quite efficient.
Yeah, well, I think the boys, especially Mina, mentions a lot, staying in your own lane. So, and it depends. Like, you can become a complete all-rounder. Like your profession doesn't dictate, how you will forever practice. Like, as we said, we've all adopted a bit of a hybridized, amalgamated approach to how we handle things, and that's largely because we all run our own businesses. So, we're interested in all aspects of, diagnostics through to treatment, through to rehab, through to, referrals off to other practitioners, and making sure you're aware of what every health professional, what their role is in the whole scheme of a client's journey. But I guess being a business owner, it forces you to develop the skills of trying to be good at everything, because for me, how I see it is, you got three parts, usually 3 or 4 parts to a treatment. You got A, the diagnostics, B, the treatment, C, or 1, 2, 3 more accurately, and then 3 is for me, the strength and conditioning rehabilitation programming. 4, if it comes into it, is more referrals to other health professionals if need be. So I wanted to make sure I was good at 1, 2, and 3. And moving away from tradition, like you mentioned, like physios are quite good at, diagnostics and maybe setting up someone on some rehabilitation, whether it be early sort of rehabilitation through to intermediate. But I made sure that I wanted to be good at the treatment side of things as well, and that's why I push a lot of the manual therapy. Excuse me. Anyway, Dan, let's start. We get too sidetracked here. We need to actually get into some of your principles as to, what you were doing. You obviously do teach and mentor everyone from personal trainers through to allied health professionals. So I think that you got a good handle on how to teach on to do these, and the principles that you sort of operate by. But I think that's also a good point that you mentioned before about because you do teach a lot of people, so you understand what it's like in the trenches, that people are getting quite overwhelmed with, do I need to know everything about rehab and everything about diagnostics and everything about what everyone else does? It's a lot to take on initially. Like I'm now 6 years into it, so I got enough experiential knowledge as well as everything else to I guess, sift through the crap and sort of work out what someone needs. But if you can start from the start as to what you would teach someone who A, is a fresh, or B, who's looking for ways to A, problem solve and work out what someone needs, through to when knowing to push someone onto more advanced rehabilitation and knowing when someone is ready to pull the trigger and return to the sport or their goal that they came to see you for.
Yeah, I think the two biggest things I kind of differentiate, like number one, when it comes to prescription and programming, it's like we have a spectrum or a continuum where we got variability on one end and specificity on the other end. So I think that's the first thing to understand in terms of like, well, how far along that continuum can you take someone? Variability, which we can kind of just consider another word for that would be movement, understanding fundamentals, anatomy, biomechanics, gait cycle, respiration, like all the fundamentals. And then on the flip side, for specificity, that's where we're starting to think more like sport. It's like sport and movement are not the same thing. They're two different things. Like sport is an expression of movement. Sport is not necessarily optimal movement or optimal health. So it's like, as practitioners, I think if you just want to do your due diligence, be able to get people out of pain, improve flexibility, improve mobility, improve like early stage motor control, motor patterns, all that kind of stuff, having a really, really good understanding of fundamentals, obviously anatomy, biomechanics, gait, respiration, that'd be the four things that are absolutely non-negotiable. That I'd start with. And it's like, if you understand those things, it gives you like a really, really good foundation of them applying early stage exercise, rehab exercise prescription, because you're basically just assessing someone and you look at, the most important thing is the way you look at them is you're looking at them through those lenses. So it's like, if you look at someone through a lens of gait, respiration, and fundamental biomechanics, it's like you're starting to look for patterns and you can start to then realize what they lack. And then the exercise prescription becomes really easy because it's just like, well, assessment, intervention, and you just keep repeating that process until you address the dysfunctions that are causing that person's issue. Then it's like, well, that's all like phase one. That's, early stage interventions, that's corrective exercise, that's, very, very basic stuff. I reckon every physio osteo practitioner should have the ability to do that, because really at uni we learn about all those things. So it's not that you don't have the knowledge, it's more so like, just how do you then get the applied knowledge and practical implementation of that as it relates to movement dysfunction. So that's what I start with. Like the first 4 modules of my course is literally those 4 things that I just talked about, because it's like, that is your foundations. From there, it's like, well, it depends how far you want to take it. And this is where I think it's more up to the individual. Number one, do you have an interest in it? Because if you don't have an interest in it, you do good at what you're naturally interested in. If you're not interested in something, yeah, you can force yourself to be good at it, but you're never going to have that passion. You're never going to be as good as someone who actually is passionate about it. Number 2 is, do you actually spend time in the trenches yourself? And this is a big one. Like, I don't think you don't necessarily have to be the strongest, the biggest, the most elite, weightlifter, powerlifter, squatter, deadlifter, footy player to be a good coach or good practitioner. But you obviously have to spend some time doing the things that you're teaching. Otherwise, it's going to be very, very hard for you to have an accurate lens of when someone comes in and they say, hey, I've got back pain, I'm a powerlifter, or I get back pain, I squat, and you never really squatted, or you've only really played around with it, you never actually had something heavy on your back. It's like, it's kind of hard to understand what they're going through, therefore, have empathy and actually align with what's happening. So I think that's the second thing that's important. It's like, you need to have an interest, you need to then have some time in the trenches, and then that would, go along with some experience as well. So you have those 3 things. It's like, cool, you have, the necessary ingredients. Now it's more just actually spending time in the trenches and working with those particular people in that demographic. And then that's where you can start to move along that continuum of like variability, where it's just movement, non-specific, just trying to improve function, strength, mobility, to, okay, well, now there's a specific outcome, which is, a sport, task specific, specific movements, specific joint angles, specific patterns that we need to replicate. So like, you have to have a really, really good understanding of that, because if you don't understand the end point of the GPS, then you're going to get lost in between. So, yeah. And that's not necessarily, I'd say that's not really the osteo-physio's job naturally. Like usually osteo, physio, chiro, allied health in general, it's like, we're going to stop at that certain point on the continuum. And that's where you would, textbook would say you hand over to an exercise physiologist, personal trainer, strength and conditioning coach. But that's like where these days, it's not really about the title, it's about the understanding. Because sure, you've had this before, you can refer to a physio, EP, personal trainer, S&C coach, and they could be just as bad because the S&C coach you referred to has no experience, knowledge, or expertise in that area. So it's like, it's more about the individual understanding the GPS of start point, end point, and what actually has to go in between versus an arbitrary, name of the person you send them to.
Yeah, I think that's good. I think, as you mentioned, marrying the two, as you said, working out, and as I've always spoke to my guys about, said your anatomy, huge foundation for you to know. Obviously, biomechanics, understanding movement and how the human moves. So if you understand what is normal, then you can work out what is abnormal. And a big part of obviously, analyzing, I guess, how someone's moves is to obviously, as you said, have the knowledge, also have the experience of working with what's normal and what's not normal. Now, we all have anatomical variances, and we all, are born with these. And then there's also taking into consideration past injury histories, taking into consideration degeneration and all that sort of thing, which will affect mobility, flexibility, will affect the joint arthrokinematics and how things work. So it's about, obviously, it's a case by case application, because each person that you deal with is not 100% going to present the same. People will present very similarly. We're all born with, not all of us. So most of us have 2 arms and 2 legs, and we all have very similar anatomy. So therefore, there is obviously general patterns that you will see. But if you want to get quite specific with certain people, it's about, and that's, I guess, becoming, I guess, a part of the 1%ers, of the ones who will be a specialist or have an expert knowledge in a certain area, is, being able to identify, those people with, the 1% issues, which is really affecting them at an elite level or professional level of sport. Now, you also mentioned good things on, which basically boils down to, the person's interests and goals. What are they aiming to do? Are they aiming to get back to soccer or to footy or to swimming or to powerlifting? And it makes a lot of sense if you've, played the sport or, had experience within, the weightlifting or whatever it may be. You'll be able to personally understand what the person's going through, even though you subjectively, you're not them, and you subjectively interpret data differently to them, but you at least will be able to have a good knowledge of what they're aiming to get to. And as you said before, coaches and health practitioners and whatever don't have to be experts in those areas, but they've got to at least understand the fundamentals of what you're getting someone back into, and in the demands that sport or task will place on the body. So I think a good starting points there is that working someone out and what their issues are. So that comes down to your problem solving skills, and B, working out to where you need to get them to. So once you work out, because this podcast is not about how to work out, exactly, why the hip has poor hip internal rotation. The idea is not to, specifically go down those rabbit holes, but let's say you've identified the movement dysfunction, or, where the problems are arising for the person. And you've also identified, where their starting point is and where their end point is what would be your next step from there? Like, let's say this person, for example, is maybe a beginner, or young training age, and they're working to get towards like sprinting, for example. And let's say they've, I don't know, torn their quad. I guess we're getting too specific here. I just want to understand your thinking process of how you would take someone from beginner to intermediate to sort of end stage.
I reckon there's one thing we should touch on first, though, in terms of like what you were saying there about sports. So I think like the biggest reason that like having an understanding of specificity, like we talked about it, like if I had to give a short list of what I say you need to understand, it's like you need to understand positions, from like a biomechanics perspective, like what does the sport require, because that's going to help you reverse engineer what you're programming. Different types of adaptations, so understanding the difference between neural adaptations, morphological adaptations, cardiovascular adaptations, and therefore that's going to determine a lot of the parameters you're training. So those things are really important. Then the third thing is that naturally understanding that sport in itself is, this might be controversial, but I think personally sport naturally requires you to be dysfunctional in some way or another, because it's beneficial to the sport. So like, I'll give an example so people understand. It's like, if you had 10 powerlifters come into the room or 10 weightlifters come into the room, I guarantee you 9 out of 10 of them would have, flared ribs, anterior pelvic tilt, extension bias issues. because for their sport is highly extension dominant. Like what they're required to do in their sport requires them to be able to get into those positions because it's advantageous. So when you look at that person from an assessment perspective, it's like you're gonna be like, oh, well, they've got a cascade of dysfunctions, they've got A, B, C, D, E, F. And naturally, if you're a practitioner who doesn't understand the sport, understand what their goals are, it doesn't mean you're a bad practitioner. It just means, well, you're looking at it through a lens of human movement, which is, this is dysfunctional, I've got to correct it. But if you're correcting some of those things, it actually might make that person less efficient at their sport. So it's like, well, that's why I think it's important too, because it's like, it's trying to get what you were saying, it's like trying to get textbook perfect is not necessarily what we're aiming for. Like having a little bit of asymmetry or a little bit of dysfunction sometimes in the right context or the right lens can actually be beneficial. Yeah. So when I look at that person now, I don't go like, my goal is to correct you. My goal is to basically choose some exercises and give them some like accessories or supplementary exercises that mitigate the potential negative effects of that person having this dysfunction. So then it's like best of both worlds, they can still have awesome performance in their sport, but I'm also making sure there's enough in there to make sure that they're not going to get too dysfunctional and kind of cause some issues.
Injured. That's right.
Versus if we then look at a diver, like Olympics is on, great example. Next time you turn the Olympics on, turn on the dive in, what do they have to do when they dive? They have to curl themselves into a ball. What position are they in? Like full body flexion. So it's like, would it be advantageous for that person to be relatively, shifted posteriorly with their center of mass, be like really flexed and, have a bunch of dysfunctions? It's like, well, it's going to be a lot easier if you had a steering wheel and you had to get the steering wheel to turn right as fast as possible. The steering wheel is already turned a little bit right. There's less distance to travel. It's more efficient. Like work equals force times distance. We've made the distance less. They have to do less work. So it's like two different people on two different ends of the spectrum that are both dysfunctional in quotation marks for those listening. But really, it's like they're dysfunctional for a specific purpose of their sport. So it's like they've gone to the depths of specificity. Worse, and if we didn't understand that stuff, then as practitioners, we're going to try and pull them back. We might actually make them worse at their sport, and it might not be the right move. If we had the same people and they were just John and Susan, it's like, well, if it's just John and Susan and their sport doesn't require elite levels of those kind of things, well, then that's a different lens we're looking at it through, because it's like, well, the trade-off, the benefit to risk, the pros and cons is not really in their favor anymore, because it's going to cause a cascade of issues in their ADLs and their day-to-day living. So I think that's why it's important. And like one of the biggest things that I teach is like, we'll make sure that you know where you sit, because that's going to affect the lens you look at things through, and therefore that's going to affect your decision making. And we don't want to get too far down the rabbit hole of every single person has to be a perfect symmetrical, functional ticking boxes in a textbook of range of motion and arbitrary assessments. Like, it needs to be, assessment should always be task specific, because then if it's not task specific, then your exercise prescription won't be task specific. So like, I'm going on a bit of a tangent, but it's because it's like, well, your exercise prescription is only ever as good as your assessment. Your assessment's only ever as good as your anatomical biomechanical knowledge and your knowledge of the task they're actually trying to achieve.
Yeah, you're right. You got to go full circle with this. It's because the product that gets spat out is only as good as quality as what obviously the process has been to get the product to that point. So I think they're all important things to mention, that as you said before, it's having the specific knowledge of what the demands of that sport or task may be, and then making sure you're relevantly applying it to maybe the dysfunctional or the exercise choice and prescription that you would give the person. I believe that obviously sports will need, obviously they will put a person in unfavorable positions and injury prone positions, but as you said before, like that is the demand of the sport. And if you want to perform efficiently and well in that sport, then these are the things that the body will need to go through. So it's about making sure you're making the body robust and resilient, and making sure you're decreasing that injury risk, because you understand that the person will be going to these positions. Like, for example, footy, you might jump up for the ball, you're bumped in the air, you will land, your knee might go into some like dynamic sort of knee valgus, internal rotation of the femur. You might be put in a position where the ACL is taut. So therefore it's about making sure you understand that person will be going through those tasks and those demands, and therefore it's my job to make sure to design a program that's going to be the most beneficial to them, to make sure that they're not going to do a catastrophic injury like rupturing the ACL. So you're
just trying to offset the effects of their sport rather than make them perfect.
Yeah, and as I said, it's not about being what we consider textbook in quotation marks. It's about just designing the best and most applicable and relevant program to the person, maintaining low injury risk, and you're maximizing as many, hypertrophy gains or power gains or endurance gains, whatever you want to get out of the program, to make sure that person's just doing, the most that they can. And I find that working with, some professional athletes, that's where you really got to be, on the ball and making sure that you're fine tuning what you're doing and making sure that you really have, your thorough assessments, as well as having thorough understanding of what these guys are actually doing, because it's hard to relate to someone like a professional athlete, because it's like, all right, well, I personally haven't been through the demands of what these blokes are going through. So it's about knowing about what you're doing, but also knowing about like so many other variables that these guys are, that you need to take into consideration. So that's a tangent itself, looking at, recovery and rest and integration of other health professionals. So as you said before, so once you've identified what the person needs, where the person's going, what would be some simple parameters around, like, all right, where would you give someone the tick of approval? All right, well, you can progress now from early stage to intermediate stage, for example.
I think it's like
very generalist as well.
Well, I could say general advice, like practitioner's advice, would be have a really thorough understanding of the actual adaptations, because then that makes the prescription easy. And because a lot of people, they get too bogged down on, sets and reps and volume, intensity and tempo, like all the specific parameters of the programming. A lot of people, like, that's the first question I always get asked, like, what's the best range and what's the best this and that. It's like, realistically, it all works and it all doesn't in the right context with the right person. So the main thing to focus on, if you had to make it super, super simple, like key takeaway would be, well, like the three things I said before: neurological adaptation, so like motor control, strength; morphological adaptations, so like sarcoplasmic, myofibrillar hypertrophy; and then like cardiovascular adaptations, or like mitochondrial adaptations, aerobic, anaerobic. It's like if you understand those adaptations at like a physiological fundamental level, and then like it makes it easy, because it's like, well, person A comes in,
or you can test and objectify it.
Yeah, it's like person A has dysfunctions A, B, and C, and they need to compete in this sport. From a biomechanical point of view, what positions are they be in? Awesome. We know mobility demands and stability demands. Next section is, okay, do they need to build muscle, build strength? We know what adaptations we're trying to achieve. And then third thing is like just understand the sport in general, and what we might need to do to offset any negative effects. And it's like, if you have those three things, then we've got that accurate GPS of like start point, end point, and then really in between it's just the process of a lot of it comes down to more individuality rather than like right or wrong. Like in terms of what I mean by that is, you can choose any single different type of method and they're all going to work. The method more depends on the person you're working with, like personal preference, access to equipment, what their skill level is, like all those kind of things are going to dictate what exercise I choose and how I prescribe it. And it's not necessarily one's good or one's bad. It's more just like, well, I've got a toolbox of 100 different options. Which one is the best in terms of benefit to risk ratio, pros and cons to get from point A to point B? So I'm like, as long as you have that perspective, I think it makes things a lot easier, versus having like at uni, the way you get taught is very arbitrary of like, well, you have to get to this point and you have to be able to tick these boxes before you go to this point. Like it sounds good on paper, but for me, I'm very competency based versus time based or numbers based, because I think that can sometimes throw you off a bit, because it's like, oh, well, they can do their 5 sit to stand for their ACL, therefore they should progress. When really it's like, well, is that specific enough to what we're trying to achieve? Does that actually mean what we think it means? Like, yeah, I'd rather just have. So yeah, it's like, it's annoying because it's like it's not a specific answer everyone wants.
Unless we run through an example.
I listened to this podcast and I got all the answers now, but it's like, that's the reality of it. You have to step back and understand adaptations, understand biomechanics, understand functional anatomy, and then understand demands of the sport, and then all the answers are within that.
And then you got to marry the two. So, So therefore, as you said, if you provide what you have framework for, A, working out the problem, B, understanding what adaptations are necessary to reach, the destination, whatever it may be, you can then design your own parameters and objective testing, et cetera, and competency testing, which you mentioned. I like that. I'm a big fan of, being competent at a skill or a task. Like I even apply it, throughout. You can apply it in whatever area in your life, and your professional life, your working life, whatever it may be, your personal life. If you are competent in that task, it means you're going to be confident at it, and that you can execute on that task quite well. And there's different levels of competency. You can be highly competent or poorly competent at something. But I think that if you design your own parameters and objective sort of testing, and this is, as you said, the individuality of it all, you need to be specific to that person. That's about offering, an elite service. Is that, well, all right, parameters for Daniel versus parameters for Nathan versus parameters for myself and Mina are all going to be different parameters, because we all have different starting points, different anatomy, different problems, and we all probably don't want to get to the same point of weightlifting, for example. You know what I mean? So we can either wrap it up there, or we can run through like an example, which might be a little bit clearer for people to understand. If you got a classic example that you run through that you're very familiar with, or we can just go show off the cuff, like it's pretty easy, whatever way you want to go.
Give me an example. What do you want?
All right, let's say, like I was going before, like I think the only way to get to really, for people to understand what we're talking about, is to obviously go through an example and then make sure we can apply it. So, for example, let's say someone has, I don't know, they got like I said before, they've got a quad tear, a rectus femoris tear. They want to get back to elite sprinting, and they've had, they tore their quad because they didn't have the appropriate sort of preparation for what they were trying to do. And that, let's say they've got like a beginner's sort of training age behind them. They got, don't have a great muscle mass. And I guess I don't know if you can work with that. That's a good starting point. But sprinting is what they want to get to. They're basically a beginner sprinter. They've just torn a muscle quad trying to sprint and basically progress through the ranks too fast.
Yeah, well, I do want to go. Okay, I'll try and keep it short and sweet. We don't go.
Let's go straight to the demands of the sport of sprinting.
So if we apply the model of before, it's like we want to think, number one, biomechanics in terms of movement demands. So what is the person actually doing? What are the joint angles? What are the positions they're in? So a lot of that's going to come down to restoring, normal gait cycle and like patterns of gait cycle. So single leg stance, understanding those types of positions. There would be lots of stuff with, single leg hinging, single leg squatting, lunging, those kind of variations to restore, kinematics of the foot and the hip, and them communicating with each other, pelvic control, all that kind of stuff, number one. And then number two would be look at the adaptations we need to create. So obviously they're going to need strength first and foremost, because strength is a byproduct to speed and power. So if you can't produce force, you're not going to be able to produce force rapidly. So strength is going to be one of the adaptations we naturally want. Number two, hypertrophy. Obviously, a bigger muscle has the potential to be stronger. So looking at myofibrillar hypertrophy in terms of building muscle and then being able to get that muscle to be neurologically active and produce force. Third thing would then be looking at more specific to the sport, which is like power and strength. So making sure our training has some sort of rate of force development in there to make sure that we're not just like big and strong when we move like really slow. Sprinting is going to mean not much contact time at the ground. Spending a lot of time with both feet off the ground in terms of like gait. So we need to be able to get strong with not strong. We need to be able to produce maximum amount of force with very, very minimal contact time on the ground. So rate of force development is a big part of it. If they've torn a muscle or torn a tendon, there'd be obviously early stage rehab. We want to be loading through, eccentric phases as well to try and restore strength and function through that muscle or that tendon, whatever we're talking about. Naturally, if we're talking about the quad, we're going to be thinking about pelvic control because of the rec fem's attachment to the pelvis. So a lot of breathing, sagittal control would be early stage stuff as well. And then I would say that's pretty much everything I would do as a clinician coach. In terms of actual like running mechanics, I would personally handball that off just because it's not like I could help them with that stuff because I understand the positions and the demands, but like I'm not a sprint coach. So in that situation, this is me, I would work with them pretty much up until they sprinted. And then when they get towards sprinting, I would either liaise with a sprint coach and I would just do the S&C and they would do the sprint specifics, or I would just handball off and take care of the S&C based stuff. And my programming would be more so, like I said, trying to offset any risks of their sport to make sure they don't get injured again, or do my best at least, and to make sure they have, they've ticking all the boxes from a movement perspective, they're ticking all the boxes from a biomechanics perspective, they're ticking all the boxes from an adaptations perspective. And then sprint training is naturally a skill. So if you want to get good at a skill, you have to sprint. Like same with footy. When you work with a lot of footy players, it's like really what we do in the gym is just GPP. If you want to get better at kicking a footy and handball on a footy, you have to kick a footy and handball a footy. Like get you bigger, stronger muscles and make you more explosive. So when you kick the footy, you can kick it 20 meters further, but you still need to actually go and do the thing. So I think that's important to understand too, is like we are just GPP, non-specific. We're just looking at variability, joint angles, adaptations, energy systems, traits of, motor control, looking at all those kind of things.
Right.
That was a very fun,
fucking,
hopefully that.
You're a gun, bro. That's a mad analysis. If you guys need to go to Dan's, you're thinking about going to Dan's courses, you definitely have to go listen to that like 5-minute off the cuff, full speed. That was a good answer, bro. That's good. I think, and you mentioned a good part there is like, all right,
biomotor qualities. Sorry, that was the word I was looking for. Biomotor qualities.
Biomotor qualities.
Yeah, it's like basically it always comes down to speed, strength, endurance, motor control, coordination. Like that's what you're training.
I've just learned a new word today, biomotor qualities. So yeah, it's a big thing, as you mentioned before, like understanding also the technical aspect of what the person's getting back to. So as you said before, like a big part of what we do is make sure you're going to make sure the body's resilient and robust enough, and it won't break down when it's trying to do these certain tasks. But as you said, when you get someone up into that sort of the upper end of the rehab, and like where you're looking to improve, their baselines and where they were before, that's where you might, as I said, introduce, a technical coach in that area. Well, as you said, if you want to get good at sprinting, sprint more. But if you want to get better at sprinting, you go to a coach or someone who's going to teach you how to technically be better at sprinting. As you said, we can improve, the muscular capacities, the cardiovascular, the neurological. We can do all those sort of things. But if you don't have a specific interest in sprinting, therefore, it's best off sending someone to a running coach or a sprinting coach where they can go, well, let's fine tune the last, you've got, X amount more potential to gain. And in this current technique that you're using, you can't access that. So let's actually, access that potential that you may have. So I think that's a good point, and it's probably a good one to wrap it up on.
I always say skill is the final step before output. So you need skill before you get to that level. If you want to squat heavy, you need to learn how to squat first. If you want to drive the most amount of volume intensity in your training, you need to have the prerequisite of motor control and skill. Otherwise, that's always going to be a limiter, your rate limiting factor, or your biggest potential of injury. So I think when you get to that point, it's like if you don't understand that skill motor control, then that's where you need to outsource or liaise with someone else. Because if you try and skip that and then go straight to output, that's where people, their strength outweighs their stability, or their capacity outweighs their skill, and that's when they generally do bad shit and they end up back on the table.
Yeah, no, it's a good point that you're making sure they got to master the skill they're doing, because as you said, as you get towards that almost return to sport or whatever it may be, that's when you're running the fastest, jumping the quickest, putting your joints through and muscles through the most, the quickest concentric, eccentric phases, etc., where you're going to have the most injury risk associated with, pushing those tissues to the limit. So I think that mastering the skill is massive in before, flogging yourself 120%.
100%. That's it.
All right, mate, you've crushed it. You've blown me away with some of that knowledge. So I think that the way you break it down into frameworks is 100% the way I like to think of things. And now you're really encouraging me to start designing some courses to really refine my knowledge, because I'm getting outdone here by the man himself. Dan's becoming the wizard now.
Can't say that, mate. Alpha will be on me.
Yeah. Oh yeah. I actually got done with the few wizard hashtags and stuff for the advertising, so you actually can't do that. All right, guys. Hopefully you enjoyed that one. There's a lot in that, so get your pen and paper out and jot some shit down. If you need to clarify any questions, whether you're a client or a practitioner, our inbox is always open. Dan's obviously running his course. Dan, when are you doing an intake as we speak?
I just started the exercise prescription course, which starts on August 16th, and then there's the mentorship intensive, which starts September 6th.
Cool. All right. Let's hopefully get this episode up and running sooner than that. So anyone listening that,
Should
If
be
you're
up by October.
interested, yeah, if you're interested in his course, reach out to him. I'm sure you can give him a call, give him an email, send him a DM, slide into the DMs. I'm sure he'll be all about it. So thanks for listening, guys. If you enjoyed it, share it. We're trying to really build our podcast. Like, we've done a piss poor effort of it so far, but yeah, screenshot on your Instagram. I'm not seeing anyone tag me in anything, so I see the listens come through every week, but I don't see anyone tagging. So
Tag.
come on, guys, we do this all for free. We take time aside to do this, so if you could, guys, do us a big favor and just share some stuff with us, I'd be very appreciative. All right, guys, thanks for listening.
Thanks, guys.